I think it is really about confidence. It gives you confidence in clinic, that you feel more ready to cope with whatever walks through the door. And because so many different things can happen and people have such a variety of issues that they arrive with, that it gives you the confidence to know that you have the skill base to handle whatever walks in through the door, I think is what the real advantage of the advanced diploma is. The other thing was I really liked some of the things that were being offered in the advanced diploma that I really wanted to be on board with, like the social nervous system, the structure and survival, and the bone therapy were all things that were really interesting to me. I've really enjoyed the nutritional biochemistry because I think partly because such buzz, the whole epigenetics thing is such a buzzword at the moment that if we're not across it, a lot of our clients are asking questions about it. So we need to understand what they're asking, but also that it covers the whole mind-body element that we're trying to reach. So we can sort out psychological issues, but being able to sort out the gut issues and look at things like methylation cycles as well, gives us the whole mind-body approach that we've actually been talking about.
I knew some of the content that was in the course and I wanted to learn it. I also wanted to do a lot of case studies. The research part of it was interesting. Also was getting a launching pad into other degrees and master's programs. It's just kind of there. It's like a subtle thing that I know I'm more confident, and I feel that the complexity of the clients that I get is reflecting that as well. Okay. And it's really good to be around other people who are other practitioners already, people who are already practicing in the course. It's good to be around those types of people while you're developing. It's all good. Nutritional biochemistry was excellent. The Qi, Yin, Yang, and blood was really good too. Probably those two together. Although they're completely different, they're really, really good subjects.
I still wasn't grasping a lot of the concepts and knew that I needed some support in how I could provide that professional connection to doctors, to physios, to any different modality within the wellness industry. And when I looked at the course and talked to a few people who have done it, I was like, oh, okay, yep, I've still got a little bit of work to do within myself, and that's a continuing process. But to be able to have the support of teachers in helping me in being able to converse with the wellness industry is vital. And also, I really was interested in the extra subjects. The aromatherapy is a big thing for me. I am quite excited about doing that part of the advanced diploma, as well as the bone therapy. But more importantly, the organ theory. I really wanted to do that because the meridians is the part that I really enjoy, and working with the points with people and exploring what that means for them. And so when I heard about organ theory, I thought, that'll help me understand it even more. And then, oh my God, I got to do the immune system, and lo and behold, here comes the social nervous system. And that's when I started to go, right, yep, we definitely needed to go on and do the advanced diploma, because it really does bring it all together. There's no, you can do all the brilliant, you can do the basics, but the advanced diploma is like bringing it all together and putting it all in one session with a client. I think that the thing that I've liked the most is the structural, the physical body stuff, being able to explore what it means for people, and then being able to help them with lordosis and scoliosis really explore and open up their life in a very different way, and not take it like it's a physical problem, like really work with the emotional side of it, but at the same time organ theory, meridians, points, that's the part that really gets me.
So I really wanted to do the advanced diploma because I really wanted the mental health aspect. So doing the psych in previous degree, I just really wanted to have that knowledge from a kinesiology point of view of how I can actually balance and bring align different things such as the hormones and that and then the bone therapy, aromatherapy, that also kind of brings in my desire to actually physically touch people, so to actually help them that way with the bone. And then aromatherapy is something that I think is not utilised as much as it could be. So that's what I wanted to kind of get a better understanding of that and how I can then help my clients with that. Best stuff so far, probably nutrition. That I wasn't as excited going into that subject. I didn't think that it was going to be something that I would utilise as much as some of the other stuff, but it's turned out to be to show me how fundamental it is, to really break it down and give me the inspiration to really pay close attention to that with my clients. I actually work in a clinic where I have a lot of other professionals. So we have chiropractors, massage therapists, and I've been able to interact with them and communicate with them better on what I can do. So, and they're actually now referring clients to me because they know that the client has emotional stuff, and they're actually recognizing it and realizing that I can help and how I can help. So that would be definitely a bonus of the advanced diploma.
I am a graduate of the advanced diploma from year 08 class, I believe it was. It's been a while since I have completed the advanced diploma, and personally what I found was that the advanced diploma gave me a lot of tools to use in terms of clinic, and it helped me really to understand a lot about the underlying aspects of a lot of the conditions that I see. I also believe that it has helped me tremendously in terms of being able to run a very successful clinic and seeing a lot of patients. Basically, by understanding more about what's going on, I'm able to explain better, which is much better received by the clients if they're understanding really what is the underlying issues and what is the science, a lot of the science behind what's going on with their particular symptoms. When I did finish off the advanced diploma, I did actually go on to study a master's degree in RMIT, in acupuncture itself, and the advanced diploma actually helped me a lot with that course as well, because it gave me a lot of background knowledge of the acupuncture system, pathology, the diagnosis, and it helped me to understand Chinese medicine on a much deeper level, and that basically gave me a lot of tools in terms of clinic as well. So now I'm both a practicing acupuncturist and a kinesiologist, and I am extremely happy that I made the decision to take on the advanced diploma, because it's benefited so many different areas of my life, including clinic and personal life.